Hey, Honey Childs. I have to say Honey Childs because my daughter said that would be a nice tag in. Today we are talking about one and why gastric bypass diet and the nutrition guidelines. I every 2 weeks I think I have to go to the nutritionist and child. She gives me a packet of something to read, and it's basically like she's not doing anything. And the funny thing about it is, she's my gastrologist too. So I'm gonna get two letters, clearance letters from her. Like she's gonna do the endoscopy, and I'm getting the endoscopy on Monday. So I wanted to let y'all know what she said to me, and she gave me a little packet or whatever. And I know everybody probably gets it when they're doing their little gastric bypass or the what is the vertical sleeve. I chose to get the gastric bypass because I only need to lose 100 pounds, and I wanted to go fast, honey. So basically, what she said that will likely improve or resolve after the weight loss surgery is diabetes, high blood pressure, obstructive sleep apnea, and the GERD, gastric reflux, GI reflux, and knee pain. Sometimes my knees bother me, and I'm too young for my knees to be bothering me, honey. So I hope that does work. The facts is the average person will lose to a point 30% or so above their ideal body weight. My ideal body weight will be 167, low threshold 180, high threshold. So about half of this weight loss occurs over the first 3 months after surgery. I am reading off of this, but whatever. And I'm drinking Mio with lemonade Mio with ice. I don't want to put it to more of my, but you can see that would be a disaster, honey. Anyway, so the good chances of improvement after weight loss surgery is CHF, which is gas congestive heart failure, um, hypoclostelemia. Oh, I don't know how to pronounce this. Urinary incontinence. So if you pee pee on yourself, it will go away. Hopefully. Menstrual irregularity, meaning infertility. The doctor says that you will, the estrogen will be, instead of soaking into your fat, it will be going right to where it needs to go. So you're highly fertile afterwards. That's good news to me, right? Back pain. And what's unlikely to improve afterwards is depression, vascular disease, arthritis, or organ damage due to stress increases, doesn't decrease. And also, they say, and I don't know, I don't want to say some people, but when I look at some of the YouTube videos, I be thinking they're drunk. So the people, the weight loss people, so they say that alcoholism also results in gastric bypass patients. A lot of gastric bypass patients become alky. So me personally, I will not become an alcoholic because I'm already one. Anyway, they said bariatric surgery alters the digestive process. So the operation promotes weight loss by closing off parts of the stomach to make it smaller. Volume restriction. The interesting fact, though, the average stomach before surgery can hold about 3 pints of food at one time. It can expand to the size of a football, and after surgery, the amount of food your stomach can hold will be greatly reduced. All right, so they start with the BMI. My BMI before I started was 40.8. Now, since I lost some weight, I lost some poundage. Is that a word, poundage? I lost some poundage. Oh, I hate my teeth. Oh, I can't wait till you go away. Anyway, after I started my BMI was 40.8. Now it is 40.1. So I'm still over there because it says you're considered obese with that BMI over 30, morbidly obese over 35, and severely morbidly obese with a BMI over 40 or 100 pounds or more of your ideal body weight. A healthy BMI is considered to be 25 or less, depending on your starting point. Your dietitian can tell you or help you figure it out, whatever. Realistically, I don't want to be small. You understand? I don't want to lose everything. I don't want to lose no titties. I don't want to lose no ass. I don't want, even though I don't have any booty, I don't want to lose it. So you already know. I just want to lose 100 pounds, and that's probably my stomach and my legs and my arms. Anyway, okay. The pre-op nutritional consult. Okay. They when you go to the first meeting or the first doctor's appointment, they're gonna take down your height, your weight, your age, your sex, your body frame. They're gonna take down your past medical history. They're gonna take down any prescribed medications you take, over the counter or um, herbal. They're gonna do compliance with medications. They're gonna do your special dietary needs in case you're a vegetarian or kosher diet, tolerances or allergies to food. Also, they're going to do daily meal preparations of food preferences to you, and fluid intake. They're also going to do preparations of meals. So if you're dining out, fast food, homemade, they'll talk about that too. Eating habits or alcohol consumption. Like I said, a lot of people when they after they have the gastric bypass and the lap band and all that, their stomachs are so small, so they get drunk faster and they sober up faster. So they want to know if you are maybe an alcoholic, maybe. But you have to, if you are alcoholic, honey child, I'm gonna give you a tip. Do not go to that meeting drunk. Don't go to the doctor's appointment drunk because they will know. And don't tell the psychiatrist that you're drunk, you're alcoholic. All right. Anyway, um, they're gonna look for your weight loss history, your mama, your father, your sisters, your brothers, your uncles, whoever likes to get down at the restaurants. They're gonna ask you in your family, so they want to know if it's genetic. Your family history, also personal experience with eating disorder. Now, I think being fat is an eating disorder. Yeah. Anyway, your activity, your exercise. Obviously, we're not doing no exercise because we wouldn't be fat if we was. Physical limitations. I was in the office one day and the girl was talking. She's like, "Well, I don't really want to stop eating my sweets. I love my sweets, and I'm not gonna walk. No, I don't go nowhere." And she was big as I was, so she had to be like 340, 350. I'm like, bitch, get your fat ass out of here. You need to go and do something with yourself for real. Gastric bypass is not gonna stop her from eating. So and she's one of them people in 2 3 years. She's gonna be on somewhere talking about the gastric bypass did not work. So you need to really know what your physical limits are. You need a support system. Right now, I have a support system consisting of my husband, my daughter, because she's older now, um, and that's basically it. Everybody else can kiss my ass. I don't really care about anybody else. I'm doing this for me, so I don't feel like nobody else should be bothered with what I'm doing. And I obviously your guy go weight. All right. So they're gonna talk about pre-operative nutrition. Your pre-operative nutrition is basically where they want to speak about what are you doing, like what are you eating? Are you eating a good quality proteins? Are you eating your lean proteins? Are you eating your dairy, your fish, your poultry, your eggs, your nuts? They want to make sure you eat foods low in saturated fats, trans fats, and cholesterol. They also want to make sure that you eat fats with the polyunsaturated and monounsaturated. Keep your total fat intake between 20% and 35% of calories. I think I'm gonna have to do this video in two parts because my camera or my iMovie will not let me edit under 15 minutes. All right, snacks or snack on fruit. Pick different colors. Make it interesting. Try one that you have never tried before. And that's crazy because when I was in Jamaica, they had like a lychee fruit and they made it with all the drinks. They had like a lychee night and it was like Chinese plum and it's so good. It has like a tangy sweet taste. Ciao. So the interesting fact with that is if you eat 100 more calories a day than you burn, you will gain about 1 pound a month. This is about 10 pounds per year. That's not okay. So the hospital stay, they got the hospital stay. You staying in there. It depends on what you are, what you got. So if you got the vertical sleeve, I think you stay in there for 1 day. If you got the gastric bypass, you stay in there for 2 days. And if you got the lap band, you stay in there. Like you can go home the same day. So the day of surgery, you will continue to be on nothing NPO, which is nothing by mouth. The following morning, your surgeon may perform a GI study to detect if you have any leaks. They call that the leak study. Once you have been cleared that your new stomach pouch does not have any leaks, we will return you to your room. Shortly, a delicious tray of clear liquids will be brought to you. Mm. The post-op diet varies among surgeons, so check with your doctor, of course. All right, so now people are so freaked out about the next 4 6 weeks of surgery. So I'm gonna talk about that, and then we're gonna do part two, and then I'll tell you about the other stuff because it's like 20 pages. Post-operative diet. Stage one diet is only liquids. The only liquids you will consume are clear, sugar-free liquids. So you will usually receive a liquid diet and a protein supplement after surgery. Now, it's very common to be afraid to take those very few sips. But remember, the sooner you tolerate your foods, the quicker you can go home. So your tray may vary from hospital to hospital, but it's generally have some waters, clear broth, diet jello, and some sugar-free juice or decaffeinated teas. The portion may be regular size, but you're given a small medicine cup to drink out of. Usually, the standard is you consume about 1.5 cup, 4 ounces every waking hour. I'm gonna be asleep the whole time, so I don't have to eat. Anyway, once it's decided by your surgery that you can advance to the next stage, which you will receive full liquids. This includes fat-free cream, soup, pudding, cream of wheat, cereal, or oatmeal, and sugar-free plain yogurt. None of this stuff tastes good. Sounds like it tastes good. It probably don't look like it tastes good. So you're gonna stay on that for like maybe the week. Then stage two diet would be mushies. Everybody call them mushies or create food, blender food, the shit that you put in the blender. So you can only start once you have successfully tolerated stage one. You'll be only allowed to consume foods that are not solid for the next 4 to 6 weeks, and it may vary from surgeon to surgeon. So it depends. Your doctor might say maybe you can eat a taco now. Anyway, cottage cheese you can eat. This is what you can eat. It says your goal is to eat approximately 550 calories to 750 calories a day, and at least 60 grams of protein. Your new stomach pouch can only handle 1 or 2 ounces, the size of one or two ice cubes at a time. So just imagine, like this is not an ice cube, but you figure like this small. Okay. Okay, so we're gonna do part two, and we're gonna do on stage two. And then I'll tell you what you can eat on the stage two diet, and because that's soft, mushy, and pre-ate food, pre pre food. All right, bye, honey child. Make sure you watch part two of this series. Bye.